So researchers are interested in this connection between the menstrual cycle and fluctuations in mood or anxiety. There's still a lot to be learned about this, but the current thought on this is that menstrual cycle is associated with fluctuations in hormones, especially estrogen and progesterone. So it's thought that those reproductive hormones actually impact neurotransmitters in our brain that are responsible for mood regulation. So remember that hormones are meant to sort of control our bodies. So if those are in flux, it's easy to see how that would filter through and impact what's going on in our brain, and then subsequently impact what's going on in our mood. So for some people, anxiety gets worse at night. Not for everyone. Some people have worse anxiety in the morning, but for some people, the anxiety gets bad at night. One of the things that could be going on with that is that during the day, our minds are always focused on something. We have a task at hand, something is going on, it's occupying our mind. At night, there's more space, and within that space, the anxious mind can kind of take up that space and start worrying about things. The other thing that can be a real difficulty for people is sleep. When you're anxious, it's harder to sleep, and so there can be a real struggle around this. It's harder to sleep, then you start feeling anxious about whether you'll go to sleep, which then makes it even harder to sleep. So it can just be a cycle. So people can be anticipating going to sleep at night, which can make the anxiety worse. So ADHD doesn't cause anxiety, but it may be a significant precipitating factor of anxiety. If you have ADHD, you're 50% more likely to experience an anxiety disorder than the general population. There's a lot of overlap, difficulty concentrating, feeling of restlessness, being on edge, difficulty controlling behavior. So much so that researchers are interested in a possible genetic link between the two conditions. But remember that ADHD is different from anxiety. ADHD really has to do with that difficulty sustaining attention, where anxiety more has to do with that feeling of tense, worried fearfulness.